No mai, haere mai. Welcome to 3 News. New Zealanders who are reliant on medicine are being urged not to panic tonight, despite strong indications from Donald Trump that pharmaceuticals are next to be targeted with tariffs. The sector was previously left exempt from Trump's universal taxes, fitting with a long-held and globally respected policy to keep medicine affordable. But today, the United States announced an investigation into the issue, casting doubt over the future of critical drug supplies and medical development. Senior correspondent Lisette Raymer reports.
A day in the life of President Trump.
President Trump, sir.
Welcome a world leader into the West Wing, a war of words with a reporter while you're in there.
Let's hear the question from this very low-rated anchor at CNN.
A word on the trade war with China.
But I don't blame China at all. I don't blame President Xi. I like him. He likes me. I mean, who knows? Who the hell cares?
And top it all off with a trademark U-turn of global consequence. A matter of life or death for many.
Look, I'm a very flexible person. I don't change my mind, but I'm flexible.
This time, it's pharmaceuticals in the president's flip-flop firing line. Originally, Trump had said the sector would be exempt from tariffs, but his flexibility has led us here, to this understated note posted to the American Federal Register, announcing the Trump administration is kicking off investigations into imports of pharmaceuticals and its threat to national security.
A tariff is a tax, so you either take that internally as a company or you have to pass it on to the users, which may well be consumers or governments that procure.
It could also reduce the amount of cash companies have to invest in research.
Which means less innovative, game-changing medicines potentially coming out in the future.
For years, pharmaceuticals have been largely tariff-free, part of a 1995 World Trade Organization agreement aimed at keeping medicines affordable.
No one wants to be in that situation where patients are not getting the medicines that they need. And for New Zealand in particular, given that in terms of our medicines access, we're at the bottom of the OECD. That's something that we will definitely be keeping an eye on.
Australia's scheme, which is a near equivalent to Pharmac, has already been red flagged by the Americans, with US drug giants lobbying Trump's team, labelling the system egregious.
We'll be announcing it soon.
Pharmac has said currently the full impact on New Zealanders' medicine and medical devices remains unclear, but they are monitoring developments and staying engaged with suppliers and relevant government agencies.
I'm very comfortable with how we're actually working with the Americans. We're doing so in a very positive, very constructive way.
The China-America relationship is not so constructive, and Chinese pharmaceuticals have already been slapped with tariffs. President Xi is currently touring neighbouring countries, building alliances and positioning China as the world's most reliable trading partner.
We're meeting, trying to figure out how do we screw the United States of America.
Douglas Pharmaceuticals, an Auckland-based manufacturer, exports around 70% of its product, but warns it's Americans who will pay the price.
It's our largest export market, so it is of concern, obviously. However, I think he may well run into some issues by trying to do this because the majority of pharmaceuticals supplied to American patients are made offshore.
Douglas thinks the president's recent decision-making is
bizarre.
But Trump has today confirmed his cognitive health check was an overwhelming success.
And I got the highest mark, and one of the doctors said, "Sir, I've never seen anybody get that kind of, that was the highest mark."
His glowing health report, a bitter pill to swallow for the millions now starting to worry about their own.
Well, OK, Lisette, so how worried should Kiwis be about their medicines?
Well, if you're a New Zealander who relies on your medicine, there's no real major urgent cause for alarm. We do have some time. Unfortunately, it's a little bit of a watch this space situation. I'm told that this investigation that the US is currently undertaking usually has around a 200-day time frame. And of course, the industry, the sector is aware of how significant this is for people. So there are a lot of conversations ongoing, a lot of engagement with the Trump administration to ensure that the best possible result is secured.
OK, Lisette, thanks so much.